Good afternoon, folks. Now we're discussing beware of hidden traps between wellness visits and physical exams. Don't get surprised. Your free Medicare wellness visit is not a physical exam. Medicare annual wellness visit versus physical exam. Know the difference. Okay, these headlines work because they surface the core misunderstanding at the heart of the issue. Medicare uses the term wellness visit to describe a preventative planning appointment. While most older adults hear annual visit and reasonably assume it means a full physical. The gap between those two interpretations is exactly where seniors get blindsided. A Medicare annual a Medicare annual wellness visit focuses on prevention. A physical exam is diagnostic and may be covered. Medicare's annual wellness visit is a planning appointment that does not include a hands-on physical or symptom evaluation. Mentioning symptoms or receiving diagnostic tests can convert the visit into a billable appointment. This framing helps seniors, caregivers, and even clinic staff quickly understand the stakes. The AVW annual wellness visit is not a checkup, and the moment the visit shifts into diagnostic, Medicare billing rules change. Social media posts. Seniors, Medicare's annual wellness visit is a preventative, not a physical. Mention symptoms or get a hands-on exam, and the visit can become billable. Ask your clinic before you go. Hands up for seniors and caregivers. Medicare's annual wellness visit is designed for prevention, medication review, fall risk, and a prevention plan. It does not include a physical exam or symptom evaluation. If you bring up symptoms or the clinician performs diagnostic checks, you may receive a bill. When scheduling, ask the office whether the visit is preventative only. Many beneficiaries assume Medicare's annual wellness visit equals an annual physical. It doesn't. The ABW is a preventative planning visit. Hands-on exams or symptom evaluations convert it into diagnostic visit and can trigger cost sharing. Clinics and policymakers should standardize scheduling. Language and pre-visit disclosures to prevent surprise billing. These posts are tuned to each platform's culture, urgency, and clarity. For X, community resource platforms, culture, urgency, and clarity. For reassurance, policy oriented precision. Okay, know before you go. Wellness visit versus physical exam. Body Medicare annual wellness visit is free and focused on prevention, medication review, memory and fall screening. And a prevention plan does not include a physical exam or evaluation. Of symptoms. If you mention a new symptom or receive a test during the visit, you may be billed. When you call to schedule, say, I want a Medicare annual wellness visit, preventative only. If you have symptoms, ask to book a separate diagnostic visit. The blurb is intentionally simple, scannable, and written at a level accessible to seniors, caregivers, and volunteers. Quick talking points for staff and volunteers. The annual wellness visit is preventative planning only. Any hands-on exam or symptom evaluation converts it into a diagnostic visit that may incur copays or deductibles. This is the line schedulers, front desk staff, and community educators can use to prevent 90% of confusion. Call to action for patients. What to do now? When scheduling, request Medicare annual wellness visit. Preventative only. Keep preventative questions separate from symptom concerns. If symptoms arise, schedule a separate diagnostic visit. Give me 1 second, folks. Ask the clinic for a cost estimate before any tests or any hands-on exams. These steps give seniors practical, concrete ways to avoid the billing trap, empowering them to get the care they need without surprise costs. Brief answer: annual wellness visit is a Medicare covered preventative planning visit. A routine annual physical is not covered by original Medicare and may trigger patient cost sharing if diagnostic services are provided during the annual wellness visit. Annual wellness visits versus annual physical. Key facts and policy actions. Background and problem statements. The annual wellness visit, AVW, is a Medicare Part B preventative benefit focused on health risks assessment and a personalized prevention plan. Annual wellness visits billing uses HCPCS codes GO438 for the initial AWV and GO439 for subsequent AVWs. AWVs do not include hands-on physical exam, routine lab work, or diagnostic testing. Performing or documenting those services converts the encounter to an evaluation and management visit and may create patient liability. Why beneficiaries and clinics get confused. Scheduling language and front desk scripting often use annual checkup interchangeably for annual wellness visit and physicals. Practices sometimes order tests or evaluate symptoms during annual wellness visits, which triggers different codes and cost sharing. CMS and professional guidance emphasize clear communication to avoid surprise bills. Standardized scheduling labels require appointment titles to state Medicare annual wellness visit, AWV, preventative only, mandatory pre-visit checklists, a one-page intake that separates preventative items from symptom concerns, and give me 1 second, folks. These are stuff. Documents patient choice to convert a diagnostic visit. EHR billing safeguards implements prompts that alert clinicians when documentation or orders will convert an annual wellness visit to an EM code and require a documented patient acknowledgement. Transparent costs communication require verbal and written cost estimates when AWV converts into diagnostic visit. Risks, trade-offs, and mitigation. Risks if under-reporting symptoms. Strict separation may deter patients from mentioning early problems. Migration allows immediate same-day diagnostic tests or diagnostic visit with documented consent and cost estimates. Operational burden. EHR changes and staff training will require investment migration. Phrased pilots with CMS. Technical assistant grants. Implementation and matrix. Pilot the standardized workflow in 10 primary care sites for 6 to 12 months. Track AVW utilization. AVW to EM conversion rates, patient compliance, claim denials, and out-of-pocket changes or charges. Report findings to CMS with recommended national guidance within 12 months. Clear scheduling, intake, EHR safeguards, and transparent costs. Communication will preserve AWV value, reduce surprise billing, and protect beneficiaries while maintaining clinical flexibility. All right, so that is A for you. I'll be back on shortly with B. Give me a bit for a break, please. And I'll be back on with B for you. For now, Gator Wellness, take care, folks.